Thank you, Mr. Chair. I speak in strong support of Ranking Member Pallone's amendment. The CLEAR Act attempts to morph the Clean Air Act from a law focused on protecting public health to one that puts the industry's bottom line first. The National Ambient Air Quality Standards set the level of air pollution that is safe to breathe. And once it's set, states and the EPA go to work to implement the standards, which is where the costs are considered. Attempting to change this tried and true structure that has made this law so successful will only lead to health harms in our communities, particularly for children, seniors, and mothers. Exposure to oil and gas well sites during pregnancy has been shown to be associated with increased risk of spontaneous preterm birth. A recent study called the Fueling Sickness, the Hidden Health Costs of Fossil Fuel Pollution, discusses how exposure to fossil fuel pollution is linked to poor pregnancy health, loss, fetal neurodevelopmental disruption, and adverse birth outcomes such as preterm birth, low birth weight, and birth defects, because pregnant women and developing fetuses are especially vulnerable to the impacts of pollution, and we need to do something about that. It's critical we do something about that because in 2024, there were more than 380,000 preterm births nationwide, accounting for nearly 36% of all infant deaths in the United States, and the United States has a D for maternal and infant health, mortality, and preterm rates. This bill will only exacerbate that crisis, leading to more preterm births and further increasing our already unacceptable infant mortality rate. In Fluvanna County, Virginia, a proposed gas plant alone is projected to result in 2 to 3 additional premature deaths each year, approximately 6 new asthma cases, and more than 1,100 asthma symptoms cases annually. It would also lead to 2 additional emergency room visits and 1 non-fatal heart attack every year, according to estimates. This is the reality that Fluvanna and countless other communities across the country will be forced to endure if this bill is pushed through without this amendment. And that is why I strongly support Ranking Member Pallone's amendment, which strikes the requirement that EPA consider likely attainability when setting NAAQS and preserves the heart of the Clean Air Act. Unfortunately, this bill is not an isolated example. Just last week, the EPA announced that it would disregard the value of human life when preparing regulatory impact analysis. With that announcement, the Trump EPA made clear that protecting industry profits, not public health, is its priority, representing a dramatic departure from the agency's core mission to protect human health and the environment. As members of Congress, it is our responsibility to ensure that the federal government serves the American people, particularly the most vulnerable and particularly their health. This bill clearly does not do that. And I urge my colleagues to stand with the American people and support this amendment. Thank you, and I yield back.